How you doing? My name is Dr. Muhammad Ali, and I'm the program director for the Physical Medicine and Rehabilitation program here in Brooklyn, New York, at the One Brooklyn Health Hospital Systems. Today we're going to be discussing lower back anatomy, just very briefly touching on some items that are common questions in the clinic that we get in terms of for patient education, some treatments, some diagnostic modalities, and things that you might want to know if you are experiencing pain in the lower back region. So as you see in the slides here, the lumbar spine, otherwise referred to as the low back, you could have mid or lower back pain from this region, and it could also radiate to the outer thigh. This is commonly misconstrued as hip pain, typically not hip pain. Again, there are exceptions to this, which is why it's important to have a specialist like myself that's physical medicine, rehabilitation trained, go through everything with you, having a thorough physical and history, and being able to figure out specifically what's wrong, including some of the diagnostic modalities we use. It can also feel as though the pain is radiating to the knee or the foot. It's kind of complicated. We'll discuss some of this very briefly, but again, another reason why this should be thoroughly evaluated by a specialist. We'll very briefly touch on the intervertebral discs that are between the bones in the spine. These are gelatinous, which basically they have a fluid-filled, kind of like a water gelatinous substance in them, so that this allows shock absorption between the bones in the spine. And again, the facet joints, as you see here, these are capsular synovial joints, just like your finger. So when your finger does this between the bones, there are synovial joints, which is a fluid-filled joint with cartilage lining it, which allows it to move freely, okay, flexing, extending. Same concept in the spine, where you would flex and extend the spine. It's very similar. The diagnostic modalities that we typically utilize are X-ray, MRI, which will allow you to see soft tissue. The X-ray will allow you to see more bony anatomy, and then electromyography, otherwise known as EMG, or nerve conduction studies, which is referred to as NCS. That basically gives you information about muscle and nerve and what's going on from the spine peripherally in the body, which will give you information about how bad a condition is, how long it's been there, and how severe it is. Typically, this will allow us to know whether a patient might need surgical intervention, which is not extremely common, thank God, for most of our patients. Typically, traditional treatment methods and conservative treatment methods work just fine. So what we're going to do is, we're going to discuss very briefly some of the regenerative medicine topics. These are platelet-rich plasma, PRP, something you guys may have heard of. It's been being utilized for years for athletes, for treatment, for restoration of function and reduction in pain. And bone marrow stem cell aspirate. This is, again, stem cells from your body that are utilized to treat various conditions, including radiculopathy or facet arthropathy, all the things that do commonly happen in the spine. We're not going to touch on all the conditions, but we'll very briefly go over them. So if we can use this model here, so you can see that this is the low back. We're going to very briefly look at some of the anatomy. Again, this is mostly for patient education purposes. So the problems that you have in the back, typically these are the bones in the back at the very bottom of the spine. You can see 1, 2, 3, 4, 5. This is typically the lower spine, otherwise referred to as the lumbar spine. You have these discs in between them, which we said are gelatinous, water-filled, and effectively they provide shock absorption for the spine. And then that may or may not cause a herniation, which could end up compressing a nerve, which radiates down into the leg. That would otherwise be known as sciatica. So that's one issue that can happen. Patients tend to have pain from these discs pressing on a nerve, and you can see this on MRI films, or you can determine on electromyography or nerve conduction study that there's some kind of contact of the nerve root. That's usually one problem, and typically if we need to treat that, it would be treated by an epidural injection, and that would allow patients to have some relief of that inflammation around the nerve root. So that's one problem that can occur. Another one is when we have more of an arthritic type component of the pain. So that would be right here. These are the capsules that we refer to, these synovial capsular joints. These are the facet joints. These typically are, again, fluid-filled with cartilage lining, allowing the bones in the spine to flex freely and extend back into place, and everything would normally glide comfortably. But again, as you age and arthritis does tend to set in, even without any major trauma or anything, just typically through age, you're going to start to have a increase in the viscosity. Things are not going to glide as well, and then you're going to have a little bit of some trouble there, and things get stiff again. rain, etc. These weather changes can affect people in terms of arthritis pain, and this is one of those things that does occur. So what normally happens is there's a nerve here that innervates this joint. You can see right here. This is the medial branch. This typically is a nerve that we would target when we do procedures. Again, being that we're assuming acupuncture and chiropractic manipulation and physical therapy have failed, typically we would target this nerve. This nerve doesn't control any muscles in your body, your legs, etc. Basically, we would try to block this nerve and see if this provided pain relief. If it did, we would progress and try to see if we could continue to treat it. Normally, you'd do the end of this sequence would be a radio frequency ablation, which would make this nerve kind of go away for a while, and unfortunately, it does grow back, and the pain will come back after about 6 to 9 months, or maybe longer, depending. So that's typically the treatment method for arthritic pain from these joints in the spine right here. And again, this would be your intervertebral disc, which could press on the nerves, which are coming out from the spine and going to the legs. If I could click here, so right there. So typically, again, your pain can come from a variety of places. This is just a very brief overview of what could be the problem, and we would go through all your tests and everything that you have, and if not, we would order the proper diagnostic studies to be able to determine what is wrong. If we were discussing non-traditional treatments besides epidurals or medial branch blocks and radiofrequency ablation, we could discuss platelet-rich plasma or bone marrow aspirate, stem cells. This is again not covered by insurance. It has been utilized for some time. There's been pretty good evidence on its restoration of function and reduction in pain. Again, this is cash-based. It could cost a significant amount of money for spinal procedures. But for platelet-rich plasma, we would take your blood and we'd spin it down, and we'd be able to utilize it to treat things such as facet arthropathy from these joints, the arthritis here, or if there's a disc that seems to have lost its water content, we can try to treat that and target it either with the platelet-rich plasma, which would be your blood primarily that we utilize, or bone marrow stem cell aspirate, which would be the stem cells inside your own body. We would utilize that to try to treat you in terms of trying to restore function and reduce pain. So that's just generally an overview of what we do. Again, we would normally want you to have a thorough history and physical examination. We would want to have all your documentation from whatever other specialists you've seen. We'll go through everything, order whatever needs to be done. And we would try to encourage acupuncture and what we call CAM therapies, complementary alternative medicine, to be able to have a holistic approach, to be able to have the patient, really do the physical therapy, regain strength, restore the musculature in their back, which it tends to be a problem. Your core and your gluteal muscles and your back muscles tend to kind of lose strength over time, and that tends to be what causes all of this pain. So we would try to target all of this and have the patient have some maybe procedures if necessary to be able to regain their ability to do the exercises and restore their function. With athletes, it's a little different. Again, they're probably more prone to utilizing these regenerative medicine therapies, but this is all case-by-case basis. Each patient is different, and we would go over everything and kind of guide you through the therapy. And again, this is why it's important to see a physical medicine and rehabilitation, otherwise known as a PM&R doctor, to be able to guide you through this. So again, my name is Muhammad Ali. I just wanted to go through some of these conditions very briefly with you. There will be some other topics and things we'll discuss more in detail, but just as a brief overview, just so you can understand kind of what's going on if you're having a pain in your back or it's been there for some time. No need to suffer. You can seek treatment. Just make sure you find the right specialist, and we'll do our best to try to get everything fixed and get you back to your normal life. All right, thanks for watching.